So good afternoon, Danny.
Hi, Alex.
Daniel Böhringer. Welcome to Senior Boulevard TV.
Thank you very much.
Thank you for accepting the invitation.
Welcome.
So these last 2 weeks, I think it's a quite now Swiss 2 weeks that we had. Last week we had the Association Avril talking about the French-speaking part of Switzerland and the senior habitat. This week we're going to talk more about the German part of Switzerland. And we've added some additional interesting topics, especially adapted to your profile. We're going to talk also a lot about innovation and digital, adding to the equation. So I really look forward to this conversation.
Okay, me too.
So Danny, before diving into the subject, perhaps a few words on your background and so forth, and your professional activities, as well as the organization you work for.
Sure. Yeah, well, it's a long time ago I studied law. Afterwards, I did an MBA here in Switzerland and in the US. I worked almost 20 years in the banking industry, especially in the payment industry, for banks as a consultant. And I'm now almost 10 years into e-health. Working there also for two different companies. Currently, I'm working for Axsana. Axsana is responsible for bringing the medical record alive in 14 cantons here in Switzerland. I'm responsible at Axsana for strategy and product development. I'm the deputy of the CEO also. The medical record here in Switzerland is a huge project ongoing now since a year. It was supposed to go live second quarter this year. As normal with large IT projects, there were a few problems. So we are now suspected to go live in the next probably 2 to 3 months. Maybe a few words on the medical record itself. The medical record is a nationwide project, and every Swiss citizen or people living here in Switzerland shall be able to have an electronic medical record. So it's actually it's volunteer. Everyone can open it up. It's not volunteer on the healthcare professional side in the hospitals and in the nursing homes. They have to offer it. So if you as a patient go in there and you have a medical record, they have to use it in your treatment. So they have to use whatever kind of documentation, medication plan, whatever you have in there. And this actually should also help to improve the quality of the treatment. Second thing we are working on is B2B improvement, transferring of data in the whole healthcare system here in Switzerland. We're coming up with a B2B infrastructure. Actually, it's going live within these days. We call it HealthLink. And it shall be sort of a basic infrastructure for the data exchange, structured data exchange, and also exchange not only between hospital nursing homes and so, but also opening up the ways to the insurances, to the cantons, to the government, to pharma, so that all the players in our healthcare system can talk to each other with standardized data, standardized processes. So it's a huge undertaking we are working on there, but that should really help as a next step for the digitalization of the Swiss healthcare system.
Yeah. Any ideas when the rollout is expected in different cantons or even national? Any indications on that?
On the medical record, I mean the planning is that somewhere in Q1 next year we will start. Not only we, but also the other providers will start then.
Okay. And perhaps what is quite particular, obviously, we have in Switzerland the cantonal system, and I think most of the people in the audience don't realize that this comes with some kind of complexity, and therefore it's perhaps also good that you provide us some insights on how the Swiss healthcare ecosystem looks like, because then people, I think, can realize what a quite an undertaking you have there with Axsana.
Yeah, happy to do so. I mean,
Yeah.
the Switzerland is comprised of 26 cantons.
Mm-hmm.
We also have 4 languages here in Switzerland, official languages.
Mm-hmm.
Now, the healthcare system itself is managed and decided on canton level. So every canton is responsible for its own healthcare system. So the government has more of a coordinating role. And that is also seen on the individual level. I mean, everyone has to have a health insurance,
Yeah.
but you're free to choose your insurance. So we have more than 50 health insurance here in Switzerland. And you have to basically, you're obliged by the law to have insurance on a basic level, and then you can choose between different levels. And I mean, what you have to know that the Swiss healthcare system is probably one of the most expensive worldwide. Per capita, we have costs of around 10,000 Swiss francs per head. So this adds up to 85 billion
Absolutely.
Swiss franc per year. So I think we have a good healthcare system, good quality. Digitalization wise, there's definitely improvements we can take, like most other countries too. But yeah, I think the big challenge here is that it's not healthcare is not on a national level, but on the canton level.
Yeah, indeed. And also, as we call it, it's a multi-payment system instead of a single payment system like we see in
Absolutely.
most European
Yeah.
countries.
Yeah.
Therefore, also, and my personal opinion, very interesting because it comes very near or in the direction of the US healthcare system, where you also have a multi-payment system. But obviously,
Yes.
here you are
Uh,
obliged to take a
yeah.
health insurance and a Swiss health insurance on top.
I think one of the differences there is something we don't know is that you can get your insurance via your employer. It's really something you have to do on your own.
Yeah, indeed. Yeah, yeah, yeah. So thank you very much for elaborating on that. And I think it's quite important because the topics that we talk about, senior habitat and so forth, is therefore also a cantonal element. Perhaps
Yeah.
are there any? Do you have any indication on statistics, especially on the German side of Switzerland, on how does the Swiss aging population looks like? Any indications on that?
Yeah, I mean, the indications are national level. I mean, if you have
Mhm.
8.5 million people living here, it's not so much different between the French and the German part.
Mhm.
Um, I mean, the Swiss people are getting fairly old, so that's very good news. I mean, males have an average of 83 to 84 years of living. Females
Yeah.
even go up to 86, so that's relatively old.
Yeah.
And we also know that 5% of the population is over 80.
Mhm.
So that leaves us with a lot of nursing homes. I mean, we have in
Mhm.
Switzerland about 1,600 nursing homes,
Mhm.
and more than 150,000 people are living in nursing homes. So this is
Yeah.
also quite a big industry. There are more than
Yeah.
100,000 people working in these nursing homes.
Mhm.
And another thing which also is very costly,
Mhm.
the average of people staying in nursing home is around 3 years.
Mhm.
And
Yeah,
if
that's really
that
long.
that's long, and I
Mhm.
think their assisted living is definitely something that could also help on the cost side. And I mean, you have to be aware of the costs for one person for 1 year in
Mhm.
a nursing home. We're going towards 100,000 euros a year. And so that's about 9,000 Swiss francs every month. So I mean,
Mhm.
that's a huge sum someone has to pay, and everyone
Mhm.
has to pay the cost for living and for caretaking. So medical costs then are borne by the insurance. If they are too high, the government comes in, the cantons come in. but this still leaves every individual with very high costs. And for a lot of people, this is more than what they get with their pension. So
Mm-hmm.
around 50% of the seniors living in nursing homes currently get subsidies from the state
Oh,
to
yeah,
help them out.
that's a lot. Yeah, 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 yeah.
And it shows us also another problem that a lot of people which have their own houses or had their own houses where they were living in apartments, they have
Mm-hmm.
to sell it because they cannot bear the costs with what money they have on the bank, so they have to sell it. And this is really also an emotional problem for the people if they have to sell what they were working for their whole life to finance the last 3 years.
Mm-hmm. Yeah, 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 I see. So, and then this becomes more and more a general problem. And I
Yeah.
think, but on the other hand, I see also that Switzerland has the highest rates of rental properties in on the European continent.
Yes.
So they are already more
Yes.
acquainted of of renting.
Yeah. Yeah. Agreed. I mean, we are definitely a population that is renting. I think up to 60% here in Switzerland are
Yeah,
renting their apartments. It's just too costly to have a house or an apartment.
yeah. And how did the Swiss cope with the existing infrastructure and offerings that there are? Any thoughts on that, Danny?
Yeah, on the assisted living side, I think there's a large potential, and
Mm-hmm.
there's also, I think the demand is higher than what is offered because I mean we were talking that we have 1,600 homes on the assisted living side. It's a bit more than 800. And around 16,000 people using assisted living apartments.
Mm-hmm.
So currently the estimation here in Switzerland is that somewhere around 20,000 beds are missing in the next 3 years.
Mm-hmm.
And there was an interesting study saying that 40% of people over 80 could imagine that they use or would like to use some kind of assisted living
Okay.
forms.
Yeah,
So that
that's a high
definitely
number.
indicates,
Yeah.
yeah, that's a very high number. And I mean, even if only part of this number really turns into people needing assisted living, then we definitely have quite a lack and quite a lot of beds missing in the next 3 years.
Mm-hmm. Very, very
Uh,
interesting. Yeah.
on the financing side, I mean, we were talking about the nursing home where
Mm-hmm.
inhabitants have to pay for living, for
Yeah.
caretaking. Here, it's the same on this side. You get no subsidies, even if you cannot afford assisted living. This is completely on the private side, so you have to
Yeah.
find ways to finance. So it could even be that you have to sell whatever you have to make sure that you can afford assisted living.
Mm-hmm.
And I mean, even if the costs are lower, the politics there started to realize that this form is very much in demand and needed here in Switzerland. And there are
Mm-hmm.
now several initiatives how the state can also help with subsidies on the assisted living
Okay.
side.
Okay.
Yeah.
And that is ongoing at this moment.
It's ongoing at this moment. I also don't know if there is anything that is coming soon, but I hear from definitely from different politicians that this is a topic that needs to be addressed and is addressed currently. But as it always is, you will have to change a few laws. You will have
Yeah.
to figure out who is financing what. And as I mean, as we were discussing
Okay.
with healthcare being on a canton level, it's probably sometimes sometime out until we have a solution there.
Yeah. 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 No, I think this is very helpful as insights, Daniel. This sets really the frame for also for the next question. That's a little bit coming closer to your territory. Is that
Okay.
how do you see actually, because it brings us to digital, that's a little bit your
Mhm.
cup of tea. And then how
Yep.
basically do you see this digital adoption in general, or even specifically towards health and all adjacent professional activities? How do you see that in the Swiss healthcare ecosystem?
Um, Yeah, I mean, the Swiss healthcare ecosystem definitely has some ways to go. We still have a lot of fax and telephones being used in the healthcare system. If you especially look at the elderly population, it's quite surprising. Swiss seniors are quite adapted to at least internet. Um, and the digital break is only around 8 years. So between up to 60 years, you all have 95% of the people, they are using internet.
Wow,
We
that's
also have a very high number of smartphone usage, up to 75%.
and iPhones
And
in particular. So
yeah, I mean, Switzerland is known to be
yeah,
an iPhone country. I think we have
yeah.
probably the highest percentage of iPhones in the countries in Europe. Yeah. Um, Now, if you look a bit closer, the elderly are using the internet more for communication. I mean, it's email, it's WhatsApp, it's staying in contact with their close ones, with the family, with the friends. Um, they are using less apps. That's what a survey showed, that it's more on the communication side. Um, what I saw now during the COVID crisis with my parents and also with my parents-in-law, um, we showed them how video communication worked.
Mhm.
So we really had the chance to stay in contact, probably more frequent than we do when we visit each other.
Mhm.
And another thing I started to realize of my parents, and I think that's quite a good thing. They started to order food over the internet, order pizza from a restaurant. So the seniors are really getting accustomed to use internet services, and I also think that this generation of my parents is by far more on the side that they're accepting help. I mean, cleaning services, whatever. They're more used to consume these kind of services. I remember my grandparents. They refused any kind of help because for them accepting help was losing their
Mhm.
self-control. And I think the next generation, which is going up to 80, is already accustomed on different kind of services, digital services. So that's generation of assisted living, I guess.
Yeah, and I think a side element that certainly must help is because of this presence of a strong infrastructure in Switzerland, and the coverage of 4G and so forth is much more, how should I say, available or present than you would see in many other countries. So you have good connectivities in Switzerland in general.
Yeah, I completely agreed. I would say the coverage is fairly good here, or much better than you see probably with other countries. I mean, the advantage is we are a relatively small country. I mean, we also have the high mountains where you sometimes have problems with your coverage, which is
Yeah,
natural. But if I travel abroad, yes, I think I have more connecting problem than I do here.
yeah. No, no, that helps. What? How do you see, in order to close the loop entirely, where does basically you
Yeah.
see the link then with technological adoption and assisted living here? Any personal perspectives on that?
Yeah, I mean, if you see what's going on, and if you see that assisted living will probably take off in the next few years, and there's a really a large gap to be covered. I think the digitalization there will help on the servicing side. I mean, if you look at telemedicine took some kind of a boost now during COVID. It's slowing down from what we hear, but we just now in the second wave, which is not good at all. And there, these kind of services are essential for elder people, which are basically now at home and try to avoid contacts. There's also the whole topic around sensors, I would say, that will be more important than ever. Until now, it was more around emergency sensors, if you fall or so. And from what we see from the development, I would say there's a next generation coming, which will really help also detecting problems early enough and help on prevention side. For example, if you see that the activity level of a person drops, you can intervene much earlier than when you already have the emergency. So I guess their digitalization will help, because what we see on the staff side is, I mean, we have a staff shortage, not only in hospital but also in nursing and assisted living too. So there we need to make sure that the digitalization will help and will support the staff. And also not only the staff, but also the relatives. And there we have to make sure that we get better communication between the supporting staff and the families. And I mean, close the loop. You have the medical record where the kids can have a look at the state of their parents. The caretaker can have a look. The medical staff will use it, and then we need some kind of communication around that. But if you have a baseline, then you can build on top. So yes, I definitely see quite a big push where digitalization will help us. And in the end, it has to be easy to use. I mean, that's the biggest thing you always hear from elderly persons. It's not easy to use, and there we definitely have to work on.
Yeah. I would add also another element that we just spoke about a few minutes ago is the fact of a very strong presence of rental market. So the
Yeah,
funds today are managing a lot of, should I say, apartments. So therefore, making the link even one step further than just managing the building and the tenants, also adding the care aspect to it is actually quite
absolutely.
more easy when you have a strong, should I say, concentrated rental base
Yeah.
than if any individual owner would make it a little bit harder, I would say. And as a conclusion, then you see this as a very strong enabler also to your organization, also your professional activities, that it actually is a good enabler to digitalize also society as well as healthcare.
No, this is, I'd say, an unstoppable wave, and we need to do it. We need to do it relatively fast. And first, as I said, we work on the infrastructure with the medical record, with the B2B exchange, and then the next is the B2C, and basically bringing the pieces together and solving the puzzle in the end. And I guess this will help all of us. And if you look at you and me in 20 years, these are the kind of services we will need too. And this is definitely our generation which has to help and support here that it will happen in the next few years, the digitalization.
Yeah, no, this was very, very, very insightful, Danny. I really enjoyed this conversation. Really, immediately
Me too.
also on the spot and all different. So I hope in the future we have other chances to exchange on more, I should I say, specified points. But
We
thanks already
definitely will.
for being there, and I look forward to seeing you next time on the platform.
Thank you very much, and
Thank you.
thank you.
Bye, Danny.
Bye. Bye, Alex.